Okay, so we've been having fun this morning placing implants with Dr. Wynn and Dr. Cotardi. We are actually doing what we call the UPIC, life experience, because we're working with great patients. The system we're using is a fully guided and with time placement. We will be placing also at the same time. We already did with temporary crowns, abutments. So the whole system comes once you scan with your X-ray and your intro camera. You send it to Uris design team and TruAbutment, and they put everything together for us. We have a surgical guide. If it's excellent, let's try it. Let's try it, doctor. Perfect. And also, we already have made from TruAbutment the customized healing abutment that we're going to be using after the placement of the implant. We have a drill protocol you can see on the screen. The sequence of the drills that we're going to be using, and the most important at the end, when we carry that implant, we're going to use a time placement. So we're just going to make sure that our sleeve that has two wings is going to match perfectly fine, as has been said in the drill protocol. This is going to be a simple implant placement, extremely conservative. I will say kind of like minimal invasive dentistry today. And we're going to be using tissue punch. We're not going to open a flap. So I'm expecting once we finish, we're going to have absolutely no bleeding in this case.